Epilepsy is a chronic disorder of unprovoked seizures. A person is diagnosed with epilepsy if they have 2 or more unprovoked seizures that were not caused by some known and reversible medical condition like alcohol withdrawal or extremely low blood sugar. A seizure is a sudden surge of electrical activity in the brain. There are 2 types of seizures. The first is epileptic. These seizures have no apparent trigger and they occur repeatedly. Epileptic seizures are also called a seizure disorder or epilepsy. What causes epileptic seizures are often unknown. The second type is non-epileptic. These seizures are triggered by a reversible disorder or another condition that irritates the brain, such as an infection or a reaction to the drug.
What are some causes of seizure disorder?
Some of the causes I don't really know. I thought they were just random to whoever.
Are all people with seizure disorder born with it?
I believe so, because I know a bunch of people with epilepsy, but I'm not exactly sure.
Do you know how often seizure disorders occur in the population?
Honestly, I don't know that much about epilepsy and the numbers that go along with that, so no.
Do you know of any types of preventions or interventions for seizures?
I don't really think I do. I would think the only thing that I could think of is maybe that medications would work to prevent them.
Do you know how medications or surgery could help someone with seizures or why they are used?
The only thing I could think of is maybe that it would stop the seizures or make them less frequent. Is there a specific kind of diet that could help a person with epilepsy?
I actually didn't know that a diet could help someone who has seizures, so I would like to know more about that.
Do you know of any technologies that are available for people with epilepsy?
I can't really think of any. Maybe a service dog if that counts, but I can't really think of any technology.
How do you think technology can help people with epilepsy?
I think it could probably help them manage their seizures. That's probably the only thing I can really think of.
What is the most common age to acquire seizure disorder?
I don't really know, but the one person that I do know with epilepsy has had it her whole life, so if I were to guess, I would say you're born with it.
Can seizure disorder be acquired through the life course?
I guess if you have a head trauma, I would think you could acquire it, or even sometimes a stroke, but I'm not really familiar, so I wouldn't say it.
What are some causes of seizure disorder?
After researching, causes vary depending on the person. The cause is most likely unknown, but depends on the person's age. Most newborns have either brain malformation, lack of oxygen during birth, low levels of blood sugar, blood calcium, or magnesium, or a maternal drug use. In infants and children, usually fevers, brain tumors, and infections are known to cause them. And in children and adults, genetic factors and progressive brain disease can cause them, which is pretty rare, or head trauma. And lastly, in seniors, either stroke, Alzheimer's disease, and trauma will cause seizures.
Are all people with seizure disorder born with it?
After research, I found that not all people are born with epilepsy. Many people develop epilepsy after the age of 1, but genetics can increase your chances of developing it.
Do you know how often seizure disorders occur in the population?
Yeah, the estimate that is most accurate is that in every 1,000 people, around 7 people have epilepsy. It has also been studied that epilepsy is more common in people with autism.
Go.
Do you know of any types of preventions or interventions for seizures?
After doing research, I found out that medications and surgery are really popular interventions and preventions for seizures.
Go.
Do you know how medications or surgery could help someone with seizures or why they're used?
I found out that for medications, typically it's the first type of intervention that a doctor suggests, and that there are all different types of medications depending on the type of seizures that people have, and that it's really important not to switch medications without talking to a doctor first, because it could have a bad result. And for surgery, I found out that people use surgery in the case that medication doesn't help their seizures, and surgeries are not always successful in stopping the seizures, and it's really important to try more than one medication before they do surgery. And that epilepsy surgery can help people who have seizures from structural brain problems. So this could be like benign brain tumor, strokes, or malformations in the blood vessels.
Go.
Do you know of any technologies that are available for people with epilepsy?
After doing research, I learned about a couple really cool technologies that people with epilepsy can use. So the first is called vagus nerve stimulation. And vagus nerve stimulation prevents seizures by sending regular mild pulses of electrical energy to the brain via the vagus nerve. It is sometimes referred to as a pacemaker for the brain. And another device that I learned about was responsive neurostimulation. And the RNS system is also similar to a heart pacemaker. It can monitor brain waves, and it also responds to activity that is different or unusual, and that could be a seizure.
Go.
There's also flicker-free monitors, and this is a device that ensures a high refresh rate to avoid screen flickering, which can trigger a seizure. And also auto dial feature in telephones, and this is where a user can press one button to call an important contact instead of calling the entire number. And this is really useful when a person has had a seizure and needs to call an immediate contact.
What is the most common age to acquire seizure disorder?
After my research, I realized that the most common age to acquire epilepsy is within the first year of life or after the age of 65.
Go.
Can seizure disorder be acquired through the life course?
Seizure disorder can be acquired during the life course, or people could be born with it. People can be born with seizure disorder due to genetic conditions or complications from birth, or they can acquire it through the lifespan through head trauma, strokes, and similar experiences.